Hi, everybody. Welcome to our Tuesdays TTC. Thanks for joining back in, or if you're new, thanks for joining with us. So every Tuesday at around 8 p.m., we're going to jump on and I'm going to interview someone who is currently on or has embarked upon or is starting their fertility journey. So today we have Andia with us. Thank you so much for joining us, Andia. It's nice to see you.
You too. I'm glad to be here. Thank you for having me.
So starting tonight, maybe you could tell us a little bit about your fertility journey.
So, thank you for including me on this conversation and our fertility journey. Where do I start? Our journey began probably just over 6 years ago, and it started out with us not thinking that there would be anything that we would have any issues or anything like that. We'd waited a little bit, my husband and I, to establish our lives before starting a family, and just by having conversations with a friend who had recently discovered, as a result of a bunch of miscarriages, that she had fibroids, and just tell me what her symptoms and all that were. It sounded it piqued a couple of little points for me, and I decided to investigate myself and go to my family doctor and ask, can you check me for fibroids? And she was like, well, why? And I said, well, because I have these symptoms. I've always had them, and I'm just curious. So she ran a bunch of ultrasounds and tests and everything. And sure enough, it came back that I had very prominent fibroids. And it's something that I had never known. Had I known sooner, maybe it could have been treated or dealt with at a younger age. So I went to a number of specialists, and one of them was also a fertility doctor. And he said, there's nothing that it looks like it's contributing to. However, if you've been trying for about 3 months and you're not getting pregnant, don't waste time and just go to a fertility doctor. And I know a lot of doctors say, oh, you have to at least be trying for at least a year before you get a referral and such. And thankfully, I had an amazing family doctor who quickly referred me to a few different clinics. And the first one took us within 2 weeks. We went. And right away, they did every kind of screening test that there was to be done. They had my MRIs about my fibroids, and I felt like confident, like we're going to get some answers and see why it's not happening for us. And as a result, this fertility doctor came back with our results about maybe a week or two later and came up with all these things. Well, your AMH is high and above normal for your age, so that's great. The fibroids are not in your uterus, so you don't have to worry about anything. I'm like thinking, great. So like, what's not happening? Then he starts saying, oh, well, then there could be something wrong with your husband's sperm and so on. So we need to investigate further, but it's nothing serious. So let's go ahead and start an IUI treatment, non-medicated. So we did. First IUI failed, and I was convinced it was going to work, and it didn't work. So there starts the devastation. And shortly after, we went right into the second cycle of IUIs. And midway through our cycle, our doctor disappeared on us due to medical malpractice, and he was gone. So we feel defeated.
That
Yeah,
must have been a whole different.
yeah, because you just don't know why this is happening from the fertility perspective. And then now your doctor, who you've put all your trust in, now you're questioning that. So we were dealing with this, and we got assigned a new doctor who didn't know anything about my history. And it was frustrating because you think a doctor's taking over your case, they're going to at least read your files. So to cut that part short, we decided to stop everything just because I didn't feel confident at this clinic. And we switched clinics and went on a wait list to see another doctor that came highly, highly referred. And thankfully, we got in on a cancellation 2 months later. We were sitting with this doctor. He ran all of his own tests and everything. Everything that the previous clinic had told us were potential indicators of what could be wrong and why we weren't conceiving were not true. And again, you feel another rush of defeat because you're like, well, I was told one thing and it's now not that.
I believe.
Yeah, so you start the whole thing again. And to this day, I'm grateful to that doctor. I remember sitting there and he's giving us all our results. He's like, you guys are just a case of unexplained infertility when I look at the information that's in front of me. And he said, he goes, so you have two options: either try IUIs again or go straight to IVF. And at this point, the IVF funded cycles had started to happen, but there was a wait list, but it wasn't as long as how they are nowadays. And my husband just asked the doctor, he said, if this was your daughter, what would you say to her? Would you say go to an IUI or IVF? And he said, my opinion, IVF, because there could be genetic issues, there could be immune issues. We won't know that if we do IUIs, and you could just be doing endless IUIs without answers. So we decided to do that. And we did all the preliminary screening tests and everything just to be prepared for the best results, and did a typical funded IVF, sorry, not funded, we paid for it ourselves. Um, Cycle of IVF, had a retrieval, great results, 10 eggs, I think 6 fertilized, and those 6 made it to PGS. We got them tested. They all came back great. And doctor's like, again, he said to us, he goes, you know what? Right before transfer, he says, maybe you guys are just meant to have a baby in a dish. He goes, sometimes it happens. So we were hopeful. And we went ahead and did our first transfer. And here I was followed. I came home, was on, laid down, took it easy, took time off work, and it failed. And it was 2 days before going in for my blood work that my cycle started. So to say that I was crushed and devastated is an understatement. I'm sure those going through this know that feeling far too well. I think I just put everything I had in that transfer, that I felt like this is it. Like, we're meant to have a baby in a dish and I'll just get pregnant. So it didn't happen. And then the doctor gave us another option. He said, okay, so this happens. This is normal. We can do another transfer right away, or we can try other tests. And I said, well, let's talk about what other tests there are, because I didn't want to waste our embryos. And I say I, but I mean we. Like, we talked about all this. It's
Oh,
just
of course, yeah. And there's that investment too. And like you said, they're not just embryos to us, right? So you want to give your best shot.
absolutely. So he said some of the other tests that we could do are doing some immune testing. And what we did was we decided to go through the immune process. Now, my doctor was one of very few doctors that does immune testing and treatment for infertility. And this was a long process, costly, but in the end, it was very much worth it. The results came back that my immunity was a factor. I won't get into the scientific terms because I don't remember them precisely to quote them and probably lead someone the wrong way. So I don't want to do that. But we did a series of immune treatments, and the treatments typically take 3 months, a 3-month period, but have a 9-month window to which they're effective. And during this time, we also decided there was a trial drug out to shrink the size of my fibroids. And it works in about 60% of patients. And so we decided to put me on these drugs as well in order to optimize the chances. And did a follow up test after the treatment's done. My levels had stabilized and come down to normal. And it was like, great. So your body is like optimally set to be receptive to an embryo. So let's try again. And we tried a second transfer. And this time I'm even more hopeful because I'm like, we found the problem, we solved it, and here we are. And again, it didn't work. So here's where my severe cycle of depression started after this, because I'd lost all hope. Because to me now, we've tried every test there is to be done, and now it hasn't worked. So what now? But we're still in that 9-month clearance window of the immune treatment. So I knew I still had time, and we still had another embryo left, or 2 embryos left. And our name came up also on the funded cycle for IVF again. And we stopped and said to the doctor, so what do we do? Do we do another transfer, or do we do another retrieval? And he said, let's go with the retrieval, because what if you get pregnant on the next one? Then you're off the funded list, and who knows when you'll get back on it. And you'll also be older to retrieve eggs at that time. So we decided to pause and did another cycle. And again, I was hopeful that we're going to get, so many embryos and have so many options. This time around, we got 22 eggs that were retrieved. more than double the first time. So I was like on cloud nine going, wow, my body's responding well. And of those 22, only two fertilized and one made it. And one made it to PGS and came back normal. The other one was not normal. Now, trying to understand this and why this happened so drastically different in less than a 12-month window, again, didn't make sense. And the way it was explained to me was that it had to do with I guess, the drug protocol that I was on. It just impacts your quality of the embryos, the eggs, and so on. Again, I don't understand all the medical and scientific terminology, but we end up having that one embryo. And this time around, because it was a funded cycle, we had to transfer that one in order to use the funding. So we were going to do that. One thing that we did change was that we decided that prior to transfer, there's a different transfusion. There's two different types of transfusions that are done for immune treatments to prepare your body right before your transfer. The cost difference is $500 versus $5,000. And I did go for the more expensive route. But we also did an ERA biopsy, and they found out that I was receptive to a transfer on day 6 versus day 5, which was typical. So that was another finding. Then, and it's funny, our doctor said to us before that last transfer, he goes, I've literally done every test there is available on you at this point. And this was in my mind because I was now in the darkest point of my depression. I was very defeated. It had put a strain on our marriage and just on my life in general, that I had checked out at this point. I was like, if this doesn't work, there's nothing left for us in this. Like, I can't go on. Even though we had embryos, I was spent. And we even looked at the option of having a surrogate if it didn't work for implantation this last time. And we decided to go ahead. Thankfully, my doctor didn't stop believing. He had hope, even though I had like a sliver of it left. We did one last transfer with that one embryo from that funded cycle. And I don't know how it happened, but we have a beautiful 3.5-year-old now as a result of that. And it was a journey that I never thought we would see that outcome because I was done. Like, my body just physically could not handle anymore. Like, it had been through so much. The weight gain, the pain, the immune treatments were difficult on the body, painful, exhausting. Financially, we were also like tapped out. We just couldn't do it anymore. So we had to make a decision, and thankful that that doctor didn't give up. So that's our story.
Firstly, Andia, thank you so much for being so brave and sharing your story and sharing it in such a vulnerable position, because I think that I know I could, and a lot of people can relate when you talked about getting to those dark points and getting to that point where you felt like you had nothing left.
Mhm.
And I think sometimes it's easy to glamorize certain aspects, or not glamorize, but almost minimize, because we want to be so hopeful and positive. And this is a very difficult journey, and everyone's journey looks different. But I know that most people and many can relate to the difficulties of it. And I really appreciate you sharing your
Thank
whole
you.
journey, including the darker parts as well.
Thank you.
That that I can only imagine was overwhelming, scary, and there was so many turning points to your journey, between your doctor finding out these different tests and unexplained infertility. There's so many questions, and so many questions that I don't think you probably still even got answers to at the end. And I can imagine that that was a moment where you really needed that support in your life. Would you mind sharing some of the places where you found support throughout that journey, or if you did find any support?
Of course. We were very private about our journey, other than like immediate family, like parents and siblings, and very, very close family and friends. Um, so that was hard because I just was. I think part of it was because I felt ashamed because I didn't know anyone in my immediate circle that was going through that. I maybe knew of like one or two people, like sisters or friends of a friend. but never anyone in my immediate family. So to me, it was like, if I share this, then what's wrong with me? And I harbored that for quite a period of time. That made me feel, and I would feel like, thinking back, I wish I wasn't like that, because I think that it would have avoided a lot of the heartache that I experienced. Because if people knew, maybe then they wouldn't have said the insensitive comments or the things that people going through infertility hear. Um, but that was part of our journey and learning and discovery. But I had immense support from our families and our close friends that knew. Um, they were sensitive to us, they understood, just checking in and being there. Like, I remember days where I didn't even want to leave the house, because at that time, and I'm sure everyone who's gone through infertility or going through it knows that when it's something you want, especially wanting to have a child, all you see around you are pregnant bellies. And I felt like I'd go out and that's all I would constantly be reminded about. So I became, and I'm naturally an extroverted person. So for me, this was even more difficult because I went into a shell and it was hard. So I knew at a certain point that I had to get help, and just talking to my parents or, my sister or friends and whatnot wasn't enough. And I ended up starting to seek therapy. And to this day, I still see my therapist. And it was the best thing that I did for my mental health and for our relationship, because it was truly taking a toll. So it was that, and just being, at least having a strong support system too. So that's what I turned to. But again, I didn't go to support groups. I didn't do any of that stuff because at that time I didn't think there was anyone else going through it, right? And I wasn't aware of this big community that exists now that I wish I had access to back then. Maybe things would have been different.
And I really appreciate you sharing that. And something that stuck out to me was that you said you didn't want to share it because you felt shame. And I feel like that is a very common feeling and something that a lot of people can also empathize with in when they're facing infertility. And I appreciate you doing this. And this is kind of what Fertility Matters is working towards, is ending that stigma, because it is something that a lot of people associate with shame. And that's not a feeling that anyone should ever have to feel, nor is it a good feeling, especially when it's something that's beyond your control. And
Absolutely.
that must have been incredibly difficult to feel. And I appreciate you sharing that.
Yes.
And I always say a good therapist has a therapist. Therapy is
Oh, they
lovely
do.
for everybody. We all have hard moments, right? We all have mental health, and that's something that is never should be shamed upon, is
Do you know
fantastic.
what? If we go to the dentist for our teeth, we go to our family doctor for everything else. Why are we not going to a therapist for our mental and emotional health, right? So, to this day, I'm thankful. I did see a therapist originally because it was actually part of our IVF program that you had to see a therapist.
Which I think is incredible.
Yeah, just because they want to know like where your mindset is. And it worked for some time with that therapist, but it got to a point where she didn't feel like she could help me anymore because my depression was getting so severe. So I had to then go beyond that, and I've been with that therapist now for probably over 5 years, so it's
Do
been
you,
great.
do you think that that was something that was fantastic about maybe the clinic you were with? Like, do you think that that was helpful
Absolutely.
in the screening process to kind of
Absolutely.
catch that?
For sure. And because at that point, when you're just starting IVF, you're not really understanding what this all means. Like, you're just like, okay, I'm just at the start of it. Let's see. Maybe I'll just get pregnant on my own. Because we even thought that, like, when we first went for our consult, I said to the doctor, I'm like, okay, well, we're going away for our 5-year anniversary. We're going to go, I'm going to come back pregnant. If I'm not, then we'll call. And the doctor's like, okay. And I totally thought I was pregnant coming back from our trip, and I wasn't. So that was one of the first stepping stones. But I think, to your question, yes, absolutely. Like, having that therapist, I was like, why don't we need a therapist? Like, we're fine. Like, this is not a big deal. We just started, right, this process. And she asked certain questions that you would have never thought of. And then it just opens another door that you go through. And then that's like you realize how much you dig deep to see the pain that you're harboring, that you don't want to let out at first.
And the very interesting thing about infertility is everyone's journey looks different. And I know that they can be incredibly long journeys and they feel so long and you just wishing you're aching for that child. But you also often, so much can happen so quick in a short span of time, even though it feels like a long, right? Like it's not like you're working up to someone explaining what IVF is. Like you said, you just jump in it. And like anything, there's grief and there's different stages of grief associated, but it's not linear because there's constantly something new that might be coming up or your journey takes a sharp turn. And for example, for you, it sounded like there were so many different things that happened that your stages of grief would be of all over the chart, right? And I
Oh yeah, like it's like it's like a roller coaster. Like one moment you're up, one moment you're down, but then it's like, when you asked like about the support system that you have, right? And it's just that support system is also what gets you through it too, I think. Is like that roller coaster is like people are there to catch you when they know you're on the down, and then they're there to lift you when you're on the way up, right? So it's part of the process, and it's like one of those things that's not known. But I think another piece that I feel like truly blessed with is that I was at a clinic where all the support staff, like, the nurses and the lab technicians, everybody is part of it with you. I remember one of my cycles, my doctor decided to extend it beyond one more day, and I didn't have drugs. And my nurse at the clinic, she met me halfway because I was at work and I couldn't go to pick up more drugs. She met me, she brought the drugs and just brought them and gave them to me so that I wouldn't miss out on it. Or, another time, one of my nurses happened to be doing the same thing for me, but I couldn't do more injections for myself because my hands would freeze. Like I would like be so tense. One day she just came over and gave me my injection. Like, and I know that's not typical, but you build these relationships and they become like your second family. And I'm grateful to all of that.
it's those little things that make that extra difference, right? It's those things
Yeah,
that are going to stand out in your mind and give
absolutely.
that little bit of comfort.
For sure.
Something that's also always resonated with me since I heard it was someone describing the almost the stages of grief or the roller coaster you're on with infertility is almost like a mountain because you hit those points and you're down and then you're up and then you're down and there's no straight line. And I find with many things grief is like that, but especially with this roller coaster, because like you said, there's always another up or bump along the way.
Always.
Throughout this journey, what is something that you've learned, whether it be about yourself, about infertility, about your journey, or something that you would have changed? What's something that you learned?
Something that I would change. I mean, I wouldn't change it because I would be then changing our story. But I would look at it as advice is that if you have the strength to be open about what you're going through, I think it may alleviate the pain a little bit. Because I think one of the things that was the hardest for me is getting asked those ridiculous questions. Well, when are you starting your family? Because children identify, signify family having been started, but like my husband and I are not a family. So it's like those insensitive points. But even after now having a child and looking at it, you still get those, right? Like people just assume now, even though you struggled for your first one, who's to say? Because everyone says your second one will be easy, but they don't realize for me, another one means that I have to spend thousands of dollars to do immune testing again and immune treatments again if that was my problem. And so it's not just like go transfer an embryo or just get pregnant on your own, right? So those are the things that I think that I would wish that I could change, is being more open to talk about it, or had potentially done differently, because I think it may have saved a little bit of heartache. Um, but also, and I think this is a hard thing, is like I sometimes think that maybe if I wasn't so playing, I guess, living in oblivion that this couldn't happen to me, then maybe it wasn't going to be as much of a shock because I never thought. I always thought, oh, we're going to try to get pregnant. I'll be pregnant right away. And it didn't happen that way. Um, and so I guess those things of just being open minded to any possibility, positive or negative, of what could happen.
And that's a really important point, and I appreciate you bringing that up. And we like to mention, which I'm sure most of everyone following us or who's listening in, but if you're new, if you're under 30 and you've been trying for 6 months, let your doctor know. And if or over 6 months, or if you've been trying for a year and you're under 30, if you're over 30 and trying for 6 months, let your doctor know. And it can't hurt to let your doctor know that you are trying, even if you're just starting. There's nothing wrong with being proactive, and it's always nice to check in.
100%. And that's the thing is like, I'm grateful for those doctors that said to me, don't wait. Mind you, I was 34 at the time, so I was over 30. So to me, I already felt like my time was running out, but because I guess everyone is used to thinking like you have your babies in your 20s, right? And here I was already past that when I'm starting to try. But I'm thankful for that. That a doctor said to me, he's like, even if you have to say you've been trying for a year, just say it and go. I was like, okay, sure. Like, but it, I wish it would have been different, but it, it is what it is, in the sense that it's something that we couldn't avoid. And we were meant to go down this road. So, but we feel grateful for what our outcome was. It definitely wasn't easy. Again, even the pregnancy wasn't easy, complications and all that. And we had a preemie, so we had to deal with that after the fact. So there was a lot of stuff after the fact too. And I think everyone automatically says, okay, when you're going through infertility, once you're pregnant, it's like, oh, this relief, right? But that relief never ends, especially like until you get to that last moment when you're holding your child.
And that's really hard too, and I appreciate you sharing that. It's true, right? And there's almost, I remember speaking to Carolyn about it, feeling like you're in this limbo, right? You're
Mhm.
not in the infertility world anymore, but you don't feel like you fit in with the other moms.
No, it's like you don't. And the other thing is you're afraid to celebrate it because you're just like, you're constantly worried because you've had so many negative things that you're just automatically, you're conditioned to assume the worst. And it's a terrible thing to feel, because you don't, who wants to feel that way, right? I mean, you're supposed to be enjoying and celebrating something. And not to say that we didn't, but it was, always, there's a pit of worry.
there's the trauma of infertility, right?
Yeah.
And there's so many mixed feelings and emotions, and I'm sure it feels different for everyone, but just because you're happy doesn't mean that it takes away everything that worked to get to where you're at.
Oh, I still, to this day, well, like I'm surprised I haven't teared up tonight. I'm holding it together quite well, I think, but or trying to. But there are many days where I like go through old photos and stuff of different periods of the journey, and um, I can start crying like at a single second because it's just like you go right in that moment, and that feeling is as raw as it was then. It is to this day. Like I don't think that'll ever leave my mind.
No, right? It feels almost like a lifetime ago, but it you can bring yourself right back to that
Oh,
moment.
yeah.
And I just have one last question.
Mhm.
If you were to meet someone right now who was just embarking upon their journey, they just got diagnosed with fertility issues, or they just met with their clinic for their first time, what's some advice that you would give to them?
Um, Find yourself a doctor that you trust. And if you feel that you don't right away, it's okay to change. It's okay to, um, because that is going to be your biggest advocate for you to have a child. And I think that asking every single question that comes to mind, if you think it's dumb or not, ask it, because it's about educating yourself, and advocating for your own health and what you want. And I'm sure I used up a lot of time in my appointments asking every question, and my doctor probably looked at me like, why do you want to know this? But ask where you're comfortable and knowing the answers, and also don't be afraid to ask for help, when you need it, especially mental and emotional health, because I denied it for a while. I wish I'd gone to it sooner, but I'm glad that I did. I think those are my biggest things. And also always have hope. I had a sliver of hope near the end, but I wish I had more. So always have hope.
Thank you so much for talking with us tonight, and thank you for sharing. That was incredibly brave, and I really appreciate you sharing your entire journey, because I know that there's a lot of people that that's going to resonate with.
Thank you. And thank you for having me tonight. And I hope it brings some hope for others going through the journey too.
Bye, everyone. We'll see you next Tuesday.
Good night.